The needle was already in her hand when the Marine stopped breathing. Dr. Evelyn Kane stood in the fluorescent glare of Oceanside VA Medical Center's emergency bay at 2:47 a.m., watching a routine shoulder dislocation become a death sentence. Everyone thought she was just another night shift surgeon, invisible by choice, forgettable by design. They had no idea what her hands had done in places the Navy would never acknowledge. For more stories like this, subscribe to Emergency Heroes Stories, and tell me in the comments, where are you listening from right now? The coastal fog pressed against the windows as Eve moved through the nearly empty ER. Her dark hair was pulled back in a bun that hadn't shifted in 6 hours. She wore the same navy scrubs as everyone else, the same white coat with her name embroidered in plain letters. Dr. E. Kane, General Surgery. Nothing about her suggested difference, except the way she moved. Economical, precise, like every motion had been calculated to save seconds. Dr. Marcus Chen stood at the central desk reviewing overnight admits. 52 years old, hospital administrator with kind eyes and persistent questions. He looked up as Eve signed in for her 3rd consecutive night shift. Dr. Kane, I've been reviewing your file. His voice was gentle but probing. Johns Hopkins Medical School, top of your class, trauma fellowship at Mass General. You could be chief of surgery anywhere. Why are you taking overnight shifts at a VA hospital? Eve met his eyes, her expression neutral. I prefer the quiet. Fewer politics, or fewer people asking questions. She didn't answer. Instead, she reached for the patient board, her fingers finding the marker with unconscious precision. Chen noticed the way she gripped it, not like a civilian doctor, but like someone who'd written triage orders while mortars fell. The ambulance bay doors burst open. 2 paramedics rushed in with a gurney carrying Corporal Danny Torres, 23 years old, muscular build, face tight with pain. His left arm hung at an unnatural angle. Male, early 20s, shoulder dislocation from training exercise. The lead paramedic called out. Vitals stable, pain level 8 out of 10. Happened during obstacle course run at Camp Pendleton. The ER resident, Dr. Sarah Odom, moved to intercept. Bay 3, standard X-ray, then we'll reduce it under sedation. Eve stayed back, observing. Torres was breathing, conscious, vitals normal on the portable monitor. Textbook anterior shoulder dislocation. Except, she stepped closer. Torres's neck muscles showed subtle asymmetry. The supraclavicular fossa on his left side appeared fuller than the right. And when he inhaled, the movement wasn't quite synchronized. Wait. Eve's voice cut through the routine bustle. Don't move him yet. Dr. Odom turned, confused. Dr. Kane, it's a simple dislocation. Look at his neck. There's subcutaneous emphysema, air under the skin. Odom squinted at Torres. I don't see anything. Eve moved to Torres's side, her fingers palpating his neck with the kind of tactile precision that couldn't be taught in classrooms. She felt it immediately. The distinctive crackling sensation of trapped air beneath the tissue, like pressing bubble wrap under skin. He has a pneumothorax developing. Probably rib fracture from the fall that nobody noticed. That's impossible, Odom said. His oxygen saturation is 98%. He's not in respiratory distress. Not yet. Eve's eyes stayed on Torres's chest, watching the rise and fall. But he will be in approximately 4 minutes when it progresses to tension pneumothorax. Dr. Chen approached, his expression serious. Dr. Kane, that's a significant diagnosis based on very subtle findings. I'm certain. Certain enough to order a chest X-ray and delay treatment? Torres gasped suddenly, his oxygen monitor dropping to 94%. His neck veins began to bulge. Jugular venous distension, classic sign of pressure building in his chest cavity. Eve didn't wait for permission. Get me a 14-gauge needle, antiseptic, and hold him still. We're doing a needle decompression. Now. Dr. Odom froze. That's an invasive procedure. We should image first. There's no time. Eve was already at the supply cart, hands moving with practiced speed. She returned with the equipment, her movements so fluid they looked rehearsed. Torres's oxygen saturation dropped to 89%. His breathing became labored, panicked. Eve positioned the needle at the second intercostal space, mid-clavicular line. the exact spot where trapped air would be under lethal pressure. Her hand was absolutely steady as she pushed through skin, through muscle, into the pleural space. The rush of air that escaped was audible, a hissing release that confirmed everything. Torres gasped, his chest expanding properly for the first time in minutes. The oxygen monitor climbed. 92, 95, 98%. Doctor. Chen stared at Eve with an expression between respect and deep curiosity. How did you know? Before Eve could answer, Torres looked up at her through sedation-heavy eyes. His voice was barely a whisper, but in the quiet ER, everyone heard it. Thank you, Commander. Eve's jaw tightened. Torres's eyes closed as the medication took hold. But the damage was done. That single word, Commander, hung in the air like an accusation. Dr. Odom's eyes widened. Commander? Dr. Kane, were you military? Eve stripped off her gloves without looking at anyone. I was a lot of things. Now I'm just a surgeon who needs to write an incident report. She walked toward the staff office, leaving behind a Marine who shouldn't be alive and questions she couldn't afford to answer. Behind her, Dr. Marcus Chen picked up his tablet and opened Eve's personnel file. Something about her story didn't add up, and he was determined to find out what Dr. Evelyn Kane was really hiding in the shadows of the night shift. By morning, Eve's name was everywhere. The overnight staff had talked. Word spread through Oceanside VA Medical Center like smoke through ventilation ducts. The quiet night shift surgeon had diagnosed a tension pneumothorax by touch alone and saved a Marine's life in under 2 minutes. And he'd called her Commander. Eve sat in the surgeon's lounge at 6:15 a.m., drinking coffee that had gone cold an hour ago. Through the window, the Pacific Ocean stretched gray and restless under the dawn sky. She'd chosen this hospital specifically for its location. Coastal, isolated, far from the Navy bases where people might recognize her face. That distance was about to collapse. The lounge door opened. Lieutenant James Nakamura, retired, stepped inside. 51 years old, surgical nurse with 23 years of Navy service, and the kind of calm that came from working trauma bays on aircraft carriers. He was the only person at Oceanside who knew fragments of Eve's real story. You're trending on the hospital's internal message board, James said, sitting across from her. 3 residents, 2 attending physicians, and the entire night nursing staff want to know how you made that diagnosis. Pattern recognition. Eve's answer was automatic, rehearsed. Eve, you palpated subcutaneous emphysema that wasn't visible. You predicted tension pneumothorax 4 minutes before it became critical. That's not pattern recognition. That's experience. She said nothing. James leaned forward. You've been here 8 months. Night shifts only. No departmental meetings. No case presentations. You avoid the cafeteria during peak hours. You park in the back lot where there are no security cameras. His voice softened. You're operating like you're still undercover. I'm not undercover. I'm just hiding. The question is from what? Or from whom? Before Eve could respond, the overhead speakers crackled to life with a tone that made both of them freeze. 3 sharp beeps followed by silence. The emergency alert reserved for mass casualty events. All senior medical staff report to the main conference room immediately. Repeat, all senior staff to main conference room. This is not a drill. James and Eve exchanged a look. In 8 months, that alarm had never sounded. They moved quickly through the corridors. The conference room was already filling with surgeons, nurses, anesthesiologists, and administrators. Dr. Patricia Holloway stood at the front. Chief of surgery, 62 years old, silver hair and a reputation for running the tightest surgical department on the West Coast. Beside her stood a man in Navy service dress blues. Lieutenant Commander Derek Walsh. 40-something, crisp uniform, and the kind of posture that said he delivered bad news for a living. Dr. Holloway's voice cut through the murmurs. At 04:22 this morning, the USS Thresher, a Virginia-class submarine conducting deep-sea exercises 200 nautical miles offshore, experienced catastrophic mechanical failure during an emergency surface drill. The room went silent. 37 crew members are being evacuated via Coast Guard helicopter and Navy rescue vessels. 12 are critical condition with injuries consistent with rapid decompression, structural collapse, and cold water immersion. She paused. They will arrive here in approximately 90 minutes. Dr. Marcus Chen, standing near the back, raised his hand. Why Oceanside? San Diego Naval Medical Center has more resources. Lieutenant Commander Walsh answered. Oceanside VA has hyperbaric chambers and specializes in veteran trauma care. Given the nature of the injuries and the time-sensitive treatment required for decompression sickness, this facility was designated primary receiving. Dr. Holloway scanned the room. We need to prep 4 ORs, mobilize all hyperbaric certified staff, and establish a triage protocol for submarine-specific trauma. Her eyes swept across the assembled doctors. Does anyone here have experience with deep-sea injuries or submarine disaster medicine? Silence. Eve felt James tense beside her. She kept her eyes forward, willing herself to remain invisible. Dr. Holloway's frustration was visible. No one? We're about to receive casualties with arterial gas embolisms, barotrauma, flash burns from electrical fires, and hypothermia complicated by saltwater immersion. These are not standard trauma presentations. More silence. Surgeons shifted uncomfortably. This wasn't their expertise. James Nakamura's voice broke the quiet. She does. Every head turned. James nodded toward Eve. Doctor, Kane has experience. Extensive experience. Eve's jaw tightened. She could feel Dr. Holloway's eyes lock onto her like targeting lasers. Dr. Kane? Holloway's voice carried skepticism and desperate hope in equal measure. You've treated submarine casualties? Eve's mind raced through a dozen possible deflections, half-truths, and evasions. But 12 sailors were dying in helicopters right now, and her pride wasn't worth their lives. Yes, she said quietly. I've treated them before. Where? When? Eve met Holloway's gaze. I wrote the Navy's protocol for submarine trauma response in 2019, after the research vessel incident in the Arctic. I trained surgical teams on hospital ships for deep-sea casualty management. The room erupted in whispers. Lieutenant Commander Walsh was staring at Eve with sudden recognition. Dr. Holloway stepped forward. Then you're leading this response, effective immediately. I can't. You can, and you will. 12 sailors are incoming, and you're the only person in this hospital who knows how to save them. Holloway's voice was steel. Whatever reason you have for hiding your expertise ends right now. Eve's hands were steady, but something inside her wasn't. She'd spent 3 years becoming invisible, and in one morning, everything had unraveled. James touched her shoulder briefly, a reminder. She wasn't alone. Eve took a breath and stepped forward. All right, here's what we need. The trauma bay smelled like salt water and jet fuel. Eve stood at the center of organized chaos, directing preparations with a precision that made the staff pause mid-movement. She'd transformed from invisible night shift surgeon to battlefield commander in under 10 minutes. Hyperbaric Chamber 1 prepped for immediate occupancy. Chamber 2 on standby. I need portable ultrasound in every bay, warming blankets set to 42 degrees Celsius, and mannitol ready for cerebral edema. Her voice carried across the ER without rising. Anyone who's not hyperbaric certified, move to support roles now. No exceptions. Dr. Holloway watched from the doorway, her expression unreadable. Dr. Marcus Chen approached Eve cautiously. Dr. Kane, you mentioned writing the Navy's protocol. When exactly? Later. Eve's eyes stayed on the trauma bay entrance. They're 2 minutes out. The memory hit her without warning. The deck of USNS Mercy pitching in Arctic waters, 2019. Commander Evelyn Kane in Navy khakis, standing before 30 surgeons and corpsmen, teaching them what civilian medicine never acknowledged, how to save men who'd been crushed by their own submarine. Arterial gas embolism is the killer, she'd told them, her voice steady despite the rolling seas. Nitrogen bubbles in the bloodstream. They lodge in the brain, the heart, the spinal cord. You have minutes to decompress them, or they die. And if you hesitate because you've never done it before, they die faster. The Present crashed back as the first Coast Guard helicopter touched down on the helipad above them. Eve's hands moved to check her equipment one final time. Muscle memory from a life she'd tried to forget. The elevator doors opened. Paramedics rushed out with the first gurney. Male, Mid-20s. Petty Officer Second Class Brian Foster. The lead paramedic shouted over the rotor noise still echoing in the shaft. Decompression sickness, altered mental status, left-sided weakness. Vitals declining during transport. Eve moved to intercept, her trained eyes scanning Foster's presentation in seconds. His pupils were unequal. His breathing was irregular. Classic signs of cerebral arterial gas embolism. Nitrogen bubbles had reached his brain. Get him to hyperbaric chamber 1. Now. Eve turned to the respiratory therapist. Prep for immediate compression to 60 feet seawater equivalent. We're treating this as type 2 DCS with neurological involvement. Dr. Sarah Odom, the ER resident from last night, stared. Shouldn't we image first? CT to confirm. There's no time. Imaging takes 20 minutes. He has maybe 5 before permanent brain damage. More gurneys flooded in. A female ensign with flash burns across her arms and face. A chief petty officer with crush injuries and hypothermia. A young technician coughing up pink frothy fluid, pulmonary barotrauma from rapid ascent. Eve directed traffic like she'd done it 1,000 times before, because she had. Different ocean, different casualties, same desperate math of triage and time. But it was Foster who broke the rhythm. Inside the hyperbaric chamber, visible through the thick acrylic window, his body began to seize. Violent whole-body convulsions that made the monitoring equipment scream alarms. The hyperbaric technician's voice crackled through the intercom. He's seizing. Protocol says administer benzodiazepines. No. Eve was already at the chamber control panel. Benzos will mask the problem, not fix it. The nitrogen bubble is expanding in his brain. We need to release the pressure directly. Dr. Holloway appeared at her shoulder. Release pressure how? He's in a sealed hyperbaric chamber. Eve's hands moved across the controls, her mind calculating risks at computational speed. We perform emergency burr holes. Drill through the skull to release intracranial pressure while he's under hyperbaric conditions. The room went silent except for Foster's seizing body and the machine alarms. That's not a standard procedure, Holloway said carefully. I've never even heard of performing cranial surgery inside a hyperbaric chamber. It's classified naval special warfare medical protocol. Eve met her eyes. I taught it to SEAL team surgeons for submarine rescue operations. It's never been done in a civilian facility because civilian facilities don't get these casualties. James Nakamura was suddenly beside her, already pulling on a hyperbaric suit. What do you need? Manual drill, sterile field, and someone who won't panic when we're locked in a pressurized tube with a seizing patient. Eve was already suiting up. That's you. Holloway grabbed Eve's arm. If you screw this up, that sailor dies and you lose your medical license. Eve's pale green eyes held something ancient and tired. If I don't try, he dies anyway. I've made that calculation before. They entered the chamber. The pressure equalized with a hiss that made Eve's ears pop. Foster's body continued its violent dance against the restraints. Eve positioned the drill with hands that had done this in far worse conditions. In field hospitals under fire. In sinking ships. In places where hesitation meant death. The drill bit pierced skull. Cerebral spinal fluid mixed with blood released in a controlled stream. The pressure that had been killing Foster's brain escaped in seconds. His seizing stopped. The monitors stabilized. Through the chamber window, Eve could see Dr. Holloway's face. Shock, awe, and one burning question forming on her lips. When they finally exited the chamber 20 minutes later, Holloway was waiting. Who the hell are you really? Doctor. Holloway's office door closed with a finality that made the air feel thinner. Sit. It wasn't a request. Eve remained standing, her back to the window where morning light painted the Pacific in shades of steel. Between them, 3 years of carefully constructed lies were about to collapse. Holloway leaned against her desk, arms crossed. I just watched you perform a procedure that doesn't exist in any civilian medical textbook. You coordinated a mass casualty response for submarine trauma like you'd done it yesterday. And every sailor we've stabilized keeps asking for Commander Kane. Her voice sharpened. So I'll ask one more time. Who are you? Eve's jaw tightened. The silence stretched until it became unbearable. Commander Evelyn Kane, former Naval Special Warfare Group. The words felt like confessing to crimes she'd already served time for. 6 deployments, trauma surgeon embedded with SEAL teams. Holloway's expression shifted from anger to something more complex. Respect mixed with confusion. Special warfare. That's not regular Navy. That's classified operations. Yes. And you're here working night shifts at a VA hospital because... Eve finally sat, exhaustion seeping through the adrenaline that had sustained her all morning. 3 years ago, South China Sea. Our team was extracting a high-value asset when everything went wrong. Enemy forces surrounded our position. Command ordered immediate evacuation. Leave the wounded. Save the mission. Holloway leaned forward, listening. I had 4 SEALs on my operating table. Critical injuries. They'd die if we moved them. Eve's voice was flat, clinical, like she was presenting a case study instead of the moment that destroyed her career. I refused the order. Told the extraction team to leave without us. I stayed behind and finished the surgeries while rounds hit the building. Jesus Christ. 3 hours later, a Marine Force recon unit broke through and got us out. All 4 SEALs survived. Eve met Holloway's eyes. And 2 weeks later, I was court-martialed for insubordination and willful disobedience of a direct order. Holloway stood abruptly. You saved 4 lives and they punished you for it? I broke the chain of command. In the military, that's unforgivable. Eve's smile was bitter. The official record says I was discharged for failure to follow operational protocols. And the real reason, the one buried in sealed files, is that my defiance exposed faulty intelligence and command failures. Punishing me publicly would have meant admitting the Navy made mistakes that endangered my team. So they buried you instead. They gave me a choice. Accept the discharge quietly and keep my medical license, or fight it and lose everything. Eve's hands rested on her knees, steady despite the tremor she felt inside. I chose survival. Changed my name slightly, moved across the country, and disappeared into night shifts where nobody asks questions. Holloway was silent for a long moment. Those 4 SEALs you saved, they know what you sacrificed? They wrote letters to the review board, testified on my behalf. It didn't matter. Eve stood. The military doesn't reward insubordination, even when it saves lives. Before Holloway could respond, both their pagers erupted simultaneously. The overhead speakers crackled. Emergency trauma alert. Incoming critical patient ETA 3 minutes. Dr. Kane and Dr. Holloway to trauma bay immediately. They moved into the corridor at a run. James Nakamura met them halfway, his face grim. It's the submarine's commanding officer, Captain Rachel Voss. Massive internal trauma, shock, and she's barely conscious. He paused. She's asking for you by name, Commander Kane. Eve felt the blood drain from her face. Rachel Voss. You know her? We served together. Joint Task Force, 2018. Eve's mind raced. If Rachel's asking for me, it means she knows I'm here. It means the ambulance bay doors burst open. Paramedics rushed in with a gurney carrying a woman in her mid-40s, navy uniform soaked with blood, face pale as death. Captain Rachel Voss's eyes found Eve immediately. Recognition flickered through the pain. Commander, she whispered, her voice barely audible. Knew you couldn't. Stay hidden. Forever. Eve gripped the gurney rail. What happened, Rachel? Implosion. Thrown against Khan during emergency surface. Voss coughed, blood staining her lips. Internal bleeding. Bad. I can feel it. Dr. Holloway was already directing the team. Get her to imaging now. Full trauma protocol. But Eve was already running her hands along Voss's abdomen, palpating with the kind of diagnostic precision that came from years of field medicine. She felt it immediately. The rigid abdomen, the defensive guarding, the subtle mass that shouldn't be there. No time for imaging. She has a traumatic aortic injury. The main artery is torn. She could rupture any second. Voss grabbed Eve's hand with surprising strength. Trust you. Finish what you started. The monitor alarm screamed. Captain Voss's blood pressure was dropping like a stone. Get her to CT now, Dr. Holloway ordered, but Eve was already shaking her head. Patricia, listen to me. A traumatic aortic injury doesn't wait for imaging. Every heartbeat is pushing blood against a torn vessel wall. She could rupture while we're getting pictures. You can't diagnose that without confirmation. The portable ultrasound was already in James Nakamura's hands. He positioned it over Voss's chest with the efficiency of someone who'd worked 100 trauma bays. The screen flickered to life, showing the grainy outline of her heart and the great vessels. There, a subtle widening of the mediastinum. The telltale shadow that meant blood was collecting where it shouldn't be. Dr. Raymond Park appeared, the hospital's cardiovascular surgeon. 60 years old, impeccable credentials, and a reputation for never taking unnecessary risks. He studied the ultrasound image, his expression darkening. Possible aortic dissection. We need to stabilize her and arrange transfer to San Diego Cardiac Center. They have the equipment and specialists for this. She won't survive transport. Eve's voice was flat, certain. That injury is minutes from complete rupture. Maybe seconds. Park turned to face her, his authority challenged in front of the entire trauma team. Dr. Kane, with all due respect, aortic repair requires cardiopulmonary bypass, specialized grafts, and a team trained in... I've repaired this injury 4 times in the field. Eve met his eyes without blinking. Twice underwater in a flooding submarine rescue vehicle with nothing but portable equipment and combat surgical kits. The trauma bay went silent except for the screaming monitors. That's impossible, Park said quietly. Aortic repair under those conditions would be classified naval special warfare protocol. Yes, it is. Eve moved closer to Voss, checking her pupils, her pulse, the subtle signs that time was running out. Captain Voss doesn't have the luxury of proper facilities or ideal conditions. She has me and whatever we can do in the next 10 minutes. Dr. Holloway stepped between them. Eve, if you're wrong, if this goes bad, then I lose everything I have left. My license, my career, maybe criminal charges. Eve's hands were already moving to prep Voss for emergency surgery. But if I do nothing, Rachel dies on this table while we debate procedure. Voss's hand shot out, grabbing Eve's wrist with surprising strength. Her eyes opened, focusing with the last reserves of consciousness. Eve. Her voice was a whisper drowned by machine alarms. Joint Task Force. 2018. Djibouti. You saved 11 men when the transport ship was sinking. She coughed, blood staining her teeth. Command wanted to abandon them. You told them to go to hell, and you saved everyone. Eve's throat tightened. I know what you sacrificed. Voss's grip strengthened. I know they destroyed you for doing the right thing, and I'm asking you to do it again. Her eyes locked onto Eve's. I trust you, Commander. Finish what you started. The monitors screamed a new alarm. Voss's blood pressure crashed, 80 over 40, falling rapidly. Dr. Park stared at the monitor, then at Eve. If we're doing this, we need to move now. Or 2 is prepped. Eve looked at Dr. Holloway, who nodded once. Permission and acknowledgement in a single gesture. James, scrub in. Dr. Park, I need your hands even if you don't trust my methods. Eve was already moving toward the surgical wing, her voice carrying commands refined over 6 deployments. Get me vascular clamps, arterial grafts, and someone on standby with 10 units of O-negative blood. They wheeled Voss toward the OR at a run, her life measured in heartbeats, and the surgeon who refused to let another person die for following orders. The operating room lights were too bright, too sterile. Nothing like the field hospitals where Eve had learned to do the impossible. Captain Voss lay on the table, chest open, her aorta exposed like a time bomb wrapped in human tissue. Eve stood with her hands inside another person's chest cavity, feeling the damaged vessel pulse weakly beneath her fingers. Doctor. Raymond Park stood across from her, his decades of cardiovascular surgery confronting something he'd never seen. Combat surgical technique brought into a civilian OR. Her pressure is dropping. The anesthesiologist called out. BP 70 over 35. She's losing volume faster than we can replace it. Eve's hands moved with mechanical precision. Every motion was economical, purposeful, refined by years of operating in places where hesitation meant death. She located the tear in the descending thoracic aorta, a 3-centimeter laceration that was bleeding into Voss's chest cavity. Vascular clamps, Eve said quietly. James Nakamura placed the instruments in her hands without being asked twice. He'd seen this choreography before, in different wars, different operating rooms, but always the same desperate dance between skill and time. Eve began the repair. Her sutures were faster than civilian technique, tighter, designed to hold under combat conditions. Dr. Park watched with an expression caught between professional admiration and disbelief. "Your hand positioning," Park said quietly. "That's not standard approach. You're compensating for limited visibility and the possibility of losing power mid-surgery." "Yes." Eve didn't look up. "When you operate in forward bases, you learn to work by feel. The lights don't always stay on." Then Voss's monitor screamed, "Pressure crashing! 50/30! The tear is extending!" The anesthesiologist shouted. Eve's hands froze for half a second. She could see it now. The laceration was propagating along the vessel wall, spreading like a crack in glass. Standard protocol required cardiopulmonary bypass, routing Voss's blood through a heart-lung machine while they repaired the damage. But initiating bypass took 15 minutes minimum. Voss had maybe 2. "We need to convert to full bypass," Dr. Park said, his voice tight with controlled panic. "This is beyond direct repair. There's no time." Eve's mind was already calculating the impossible math. "We cross-clamp the aorta above and below the injury, repair it in under 4 minutes, then release. Any longer and her organs start dying from lack of blood flow." Park stared at her. "That's a battlefield technique. It's not approved for civilian use because the risk of organ failure is—" "I've done it 4 times. Different oceans, different casualties, same injury." Eve's voice was absolutely calm. "It works if you're fast enough. And if you're not, then she dies. But she's dying right now, so the outcome is the same." Eve positioned the vascular clamps. "I need everyone in this room to trust me for the next 4 minutes. Can you do that?" Silence. Then James spoke, his voice steady. "I trust you, Commander." Dr. Park looked at Voss's monitor, at the blood pressure falling into lethal territory, at the surgeon whose hands had already saved lives in conditions he couldn't imagine. "Start the timer," Park said. Eve placed the clamps. Voss's blood flow to her lower body stopped completely. The clock began. 4 minutes, James announced. Eve's hands moved faster than surgical teaching allowed. Her sutures were combat tight, each one placed with the muscle memory of someone who'd done this in helicopters, in sinking ships, in places where perfection was impossible but good enough meant survival. No wasted motion, no hesitation. Just hands that had learned to save lives when everything else was failing. 3 minutes. Sweat appeared on Dr. Park's forehead. He'd never seen anyone move this fast with this much precision. It violated every principle of careful, methodical surgery he'd spent 40 years perfecting. But it was working. 2 minutes. The tear was closing. Eve's sutures formed a perfect line of interrupted stitches, each one reinforcing the vessel wall, each one holding back the pressure that wanted to tear it apart. 1 minute. Eve tied off the final suture. Her hands moved to check the repair, palpating the vessel for any weakness, any sign of continued leaking. Nothing. The repair was solid. 45 seconds. Releasing clamps now. Eve's voice was steady despite her racing heart. The clamps came off. Blood rushed back into Voss's lower body. The aorta held. 3 minutes, 42 seconds, James said quietly. The monitors stabilized. Blood pressure climbed. 60/40, 75/50, 90/60. Dr. Park was staring at the repair like it was a magic trick he couldn't explain. That's impossible. Nobody works that fast. Combat surgeons do, Eve said simply. Because our patients don't have the luxury of time. The surgical lounge felt smaller than it had that morning. Eve sat alone, still in blood-stained scrubs, her hands wrapped around a coffee cup she hadn't touched in 20 minutes. Through the window, the afternoon sun painted the Pacific in gold and shadow. Captain Voss was stable in the ICU. 12 submarine crew members were alive, and Eve's carefully constructed invisibility had shattered completely. The door opened. Dr. Holloway entered, followed by a man in Navy service dress blues. Rear Admiral Thomas Crane, 60 years old, silver hair, and the kind of face that had delivered bad news to hundreds of families. Eve recognized him instantly. The last time she'd seen that face, it was across a courtroom, prosecuting her for saving lives. Dr. Kane. Admiral Crane's voice was formal, measured. "May we speak privately?" Dr. Holloway glanced between them, reading the tension. "I'll be outside if you need me, Eve." The door closed. The silence stretched like a wound. "You were supposed to disappear," Crane said finally. "That was the deal. Honorable discharge, keep your medical license, and fade into obscurity where nobody would ask questions." Eve set down her coffee cup with deliberate care. "I did disappear. Night shifts at a coastal VA hospital. No publications, no conferences, no attention. I kept my end of the bargain. Until today. Until you saved 12 sailors using techniques that are classified at the highest levels." Crane moved to the window, his back to her. "Naval special warfare protocols. Combat surgical methods that don't exist in any civilian medical database. You exposed yourself, Commander. Former Commander. You made sure of that. I did what the Navy ordered me to do." He turned to face her. "The South China Sea operation. You remember what happened? I remember saving 4 men while you wanted me to abandon them." Crane's expression hardened. "You remember insubordination. Willful disobedience of a direct order during a classified operation." He paused. "What you don't know is why that order was given." Eve stood slowly. "Enlighten me." "The intelligence report that sent your team into that compound was faulty. The high-value target wasn't there. Command knew it 30 minutes before extraction, but pulling out would have meant admitting the operation was based on bad intel." Crane's voice dropped. "Your commanding officer ordered you to evacuate because staying longer would have exposed how badly we'd screwed up." The room tilted slightly. "You sent us in knowing the intelligence was wrong?" "Not me. People above my pay grade who didn't want to admit failure." Crane sat heavily in the chair Eve had vacated. "When you refused to leave those wounded SEALs, you forced us to send in a rescue team. That rescue team's deployment created a record. Questions were asked. Investigations started. So you court-martialed me to cover up command failures. We scapegoated you to protect institutional credibility." He met her eyes. "Punishing you publicly meant we could avoid explaining why the operation happened in the first place. Your insubordination became the story instead of our incompetence." Eve's hands clenched into fists. 4 men are alive because I stayed, and you destroyed my career for it." "I know." Crane's voice carried something that might have been regret. "I followed orders, just like you were supposed to. The difference is, I didn't have the courage to refuse." He stood. "And now you've reminded everyone how good you actually are. 12 sailors are breathing because a surgeon the Navy threw away decided saving lives was more important than staying hidden. Why are you telling me this now? Because in 6 hours the media will descend on this hospital. Captain Voss is a national hero, and the surgeon who saved her life will be front-page news." Crane moved toward the door. "The Navy can't bury you twice, Commander. This time everyone will know what you can do." He paused at the threshold. "The question is, what are you going to do with that?" The door closed. Eve stood alone in the surgical lounge, no longer invisible, no longer protected by obscurity. Outside, the Pacific stretched endless and unforgiving, like the truth that had finally caught up to her. Eve had been awake for 22 hours when the second wave hit. The emergency bay doors burst open at 4:47 p.m., and 3 more gurneys flooded into the trauma center. The submarine casualties that hadn't been critical enough for the first extraction had deteriorated during transport. "Petty Officer First Class Miguel Santos," the Coast Guard paramedic shouted over the chaos. 29 years old, decompression sickness. Started treatment in hyperbaric chamber on the rescue vessel, but he's getting worse, not better. Eve was already moving toward the gurney. Santos's face was contorted in pain, his left side twitching with involuntary movements. His pupils were dilated and sluggish, classic signs of cerebral arterial gas embolism. Nitrogen bubbles had reached his brain. "Get him to hyperbaric chamber 2, Eve ordered. "Continue oxygen at 100% and prep for immediate recompression." Dr. Marcus Chen intercepted her in the hallway. "Dr. Kane, he's already been under hyperbaric treatment for 90 minutes. Standard protocol says..." "Standard protocol isn't working." Eve checked Santos's chart on the portable tablet. "His symptoms are progressing despite treatment. That means we're missing something." They wheeled Santos into the hyperbaric chamber. The medical team initiated compression to 60 feet seawater equivalent, the standard depth for treating severe decompression sickness. Eve watched through the thick acrylic window as the pressure increased. Santos's condition worsened. His seizures intensified. The cardiac monitor showed arrhythmias that shouldn't exist if this were simple decompression sickness. He's not responding. James Nakamura said quietly beside her. Eve, what are we missing? Eve's mind raced through every case she'd seen, every submarine casualty, every impossible presentation. Then it clicked. A memory from 2017, Arctic operations, a SEAL diver with the exact same pattern, paradoxical gas embolism. Eve's voice cut through the worried murmurs. He has an undiagnosed cardiac defect, a hole in his heart that's letting nitrogen bubbles bypass his lungs and go straight to his brain. Dr. Raymond Park appeared, still in surgical scrubs from Voss's operation. That's incredibly rare. We'd need an echocardiogram to confirm. Then get me one, now. 10 minutes later, the portable ultrasound confirmed what Eve already knew. Patent foramen oval. A small opening between the heart's upper chambers that should have closed in childhood but didn't. In Santos's case, it had turned a survivable injury into a death sentence. The only way to save him is to close that defect, Eve said, her voice steady despite the impossible task ahead. We need to perform cardiac catheterization while he's still under hyperbaric pressure. The room went silent. That's never been done here, Dr. Park said. We don't have the equipment modifications for catheterization inside a pressurized chamber. We don't even have protocols. Then we improvise. Eve turned to face him. That's what combat medicine is. You work with what you have, not what you wish you had. Dr. Kane, this is beyond improvisation. This is experimental. This is a 29-year-old sailor who will die in the next hour if we debate procedure instead of acting. Eve's green eyes held Park's. I've done emergency procedures in worse conditions. Sinking ships, flooded compartments, zero visibility. This chamber has lights, oxygen, and equipment. It's practically luxury. James was already gathering modified catheterization equipment. What do you need? Eve began listing supplies, her mind already mapping the procedure. Dr. Holloway appeared in the doorway, and Eve explained the situation in 30 seconds. Do it, Holloway said simply. Whatever you need. Dr. Park stared at Santos's deteriorating vitals, then at Eve. If this works, you'll have performed a procedure that doesn't exist in any medical textbook. And if it doesn't work, he dies anyway. Eve was already suiting up for chamber entry, so we might as well try. The hyperbaric chamber wasn't designed for cardiac surgery. Eve and Dr. Raymond Park stood inside the pressurized steel cylinder, surrounded by modified catheterization equipment that James Nakamura had jury-rigged in 20 minutes. The portable fluoroscopy machine hummed against the curved wall, its imaging screen showing Santos's heart in grainy black and white. Outside the acrylic window, Dr. Holloway stood with her arms crossed, her expression caught between professional curiosity and the knowledge that hospital legal counsel was going to have a field day with this. Pressure stabilized at 60 feet. The chamber operator announced through the intercom, "You have full atmospheric control." Eve positioned the catheter at Santos's femoral artery. The thin wire would travel up through his vascular system, through his heart, and deploy a small closure device over the patent foramen oval, the hole that was killing him. I've done hundreds of these procedures, Dr. Park said quietly, his hands assisting Eve's, but never under pressure. Never in a hyperbaric chamber. Then today you learned something new. Eve advanced the catheter, watching its progress on the fluoroscopy screen. The wire snaked through Santos's iliac artery, up his aorta, into his heart. The technique required absolute precision. One wrong move, and the catheter could puncture a vessel wall or trigger a fatal arrhythmia. Eve's hands moved with the steady confidence of someone who'd performed procedures in far worse conditions. Approaching the atrial septum, she narrated for the team watching outside. Visualizing the PFO now. The screen showed the exact location, a small dark spot between the heart's upper chambers where blood and nitrogen bubbles were crossing paths. Eve began threading the closure device through the catheter. This was the critical moment. The device needed to deploy on both sides of the hole simultaneously, like an umbrella opening inside Santos's heart. Then, the fluoroscopy screen went black. Power failure. James's voice crackled through the intercom. Urgent, but controlled. The modified equipment is overloading the chamber's electrical system. We're resetting now. Dr. Park's eyes widened. We can't continue without imaging. We're operating blind. No. Eve's voice was absolutely calm. I'm operating blind. You're going to talk me through the anatomy while I work by feel. Eve, that's impossible. I've done this before. Different context. Same principle. Her hands stayed perfectly still. The catheter positioned exactly where it needed to be. In 2020, South Pacific Submarine Rescue Operation performed an emergency pericardiocentesis in a flooded compartment with zero visibility. You learned to see with your hands. She closed her eyes, blocking out every distraction. Her entire world became the tactile feedback traveling through the catheter, the subtle resistance of tissue, the pulse of blood flow, the anatomical landmarks she'd memorized from thousands of procedures. Deploying the device now, Eve said quietly. Dr. Park watched in disbelief as her hands made micro-adjustments, responding to sensations he couldn't perceive. She was navigating Santos's heart, using nothing but touch and anatomical knowledge refined over years of impossible surgeries. First disc deployed, Eve narrated, feeling for the septal wall. There. Positioning second disc. The chamber was silent except for Santos's cardiac monitor and Eve's steady breathing. Outside, the entire trauma team pressed against the observation window, watching a procedure that shouldn't be possible. Second disc deployed, checking position by palpation. Eve's fingers made minute adjustments to the catheter. Devices seated, releasing deployment mechanism. The fluoroscopy screen flickered back to life. The image showed the closure device perfectly positioned, both discs straddling the patent form an oval, the hole sealed completely. Oh. Park stared at the screen, then at Eve. That's perfect placement. You did that completely blind. Not blind, just using different senses. Eve withdrew the catheter slowly, watching Santos's vitals stabilize in real time. His oxygen saturation climbed. The arrhythmias disappeared. The nitrogen bubbles, no longer able to cross through his heart, began dissolving harmlessly. He's normalizing, the chamber operator said, his voice carrying disbelief. All vitals returning to acceptable ranges. Eve stepped back, stripping off her gloves. Santos was breathing easier now, his face relaxed for the first time since arrival. Dr. Park removed his own gloves, his hands trembling slightly. I've been doing cardiac procedures for 30 years. I just watched you perform one that doesn't exist in any textbook, using a technique that shouldn't work, in an environment that's never been attempted. He paused. Who the hell trained you? Eve met his eyes through the chamber's harsh lighting. War did, and war doesn't give you the luxury of perfect conditions. The media vans arrived at dawn. Eve stood in the hospital corridor, watching through the window as news crews set up cameras and satellite equipment in the parking lot. The submarine disaster had become national news overnight, and someone had leaked the name of the surgeon who'd saved 12 lives using techniques that shouldn't exist. Dr. Evelyn Kane, formerly Commander Kane, United States Navy. The reporter's voice drifted through the television mounted in the waiting area. Sources confirm she was court-martialed 3 years ago for insubordination, but performed multiple life-saving procedures during yesterday's submarine crisis. Dr. Marcus Chen appeared beside her. They're calling you a hero. The hospital's phone lines have been jammed since 5 a.m. with interview requests. I'm not a hero. I'm a surgeon who did her job. A surgeon the Navy threw away, Chen said quietly. And now everyone wants to know why. In the ICU, Captain Rachel Voss had recovered enough to speak. Against medical advice and Dr. Park's protests, she'd insisted on holding a press conference from her hospital bed. Eve watched on the waiting room television as nurses positioned cameras around Voss's room. Voss's voice was weak but clear. I'm alive because of Dr. Evelyn Kane. She diagnosed my injury within minutes, performed an emergency aortic repair using combat surgical techniques, and completed the procedure in under 4 minutes. She paused, gathering strength. She's the best combat surgeon I've ever served with. The Navy should be ashamed they let her go. The reporters erupted with questions. Captain Voss, can you confirm Dr. Kane was court-martialed? Was she discharged dishonorably? Why was a Navy surgeon working at a VA hospital? Before Voss could answer, Rear Admiral Thomas Crane stepped into frame, his dress blues immaculate, his expression carefully controlled. Dr. Kane's separation from the Navy was a complex matter involving classified operational details, Crane said, his voice carrying the weight of institutional authority. What I can confirm is that she served with distinction for 6 deployments and saved countless lives in the most dangerous conditions imaginable. Was she wrongfully discharged? A reporter pressed. Crane's jaw tightened. Commander Kane made decisions in the field that conflicted with operational orders. The circumstances surrounding those decisions remain classified. However, yesterday's events demonstrate that her medical expertise is beyond question. And it was the closest thing to an apology the Navy would ever give. Eve turned away from the television, unable to watch anymore. She walked through the quiet corridors until she reached the surgical wing, the one place that still felt like refuge. James Nakamura found her there, sitting in the locker room, still wearing yesterday's scrubs. "You saved 12 people in one night," he said, sitting beside her. A Marine with tension pneumothorax, a sailor with cerebral gas embolism, Captain Voss with a torn aorta, and 9 others who would have died without your intervention. That's the only story that matters. Is it? Eve's voice was hollow. Or is the story about a disgraced military surgeon who couldn't follow orders? The story is about someone who refused to let people die because some admiral prioritized politics over lives. James's voice was firm. You did the right thing 3 years ago. You did the right thing yesterday, and everyone except the Navy brass knows it. The door opened. Dr. Patricia Holloway entered, holding a manila folder. The board met this morning. Emergency session. She sat across from Eve. "We have a problem, Dr. Kane. You're qualified to work night shifts and assist in routine surgeries. But what you did yesterday, that level of expertise, that kind of skill, we can't waste it on overnight coverage." Eve looked up. "What are you saying?" "I'm offering you the position of Director of Trauma Services. Full authority over emergency protocols, surgical training, and disaster response." Holloway opened the folder, revealing a contract. "Oceanside VA is about to become the premier trauma center on the West Coast, and you're going to build it." Eve stared at the papers. "Patricia, you're still the best trauma surgeon I've ever seen. The politics, the court-martial, the past, none of that matters inside this hospital." Holloway's expression softened. "You've spent 3 years hiding. It's time to stop." Through the window, the Pacific Ocean stretched endless under the morning sun. No longer a barrier to escape behind, but an horizon full of possibility. 3 months changed everything. The Oceanside VA Trauma Institute stood where an abandoned wing once collected dust. Eve walked through the renovated facility, watching residents practice emergency procedures on high-fidelity simulators designed to replicate combat conditions. Flooding compartments, power failures, mass casualty scenarios. Dr. Raymond Park stood at a teaching station, demonstrating the cross-clamping technique Eve had used to save Captain Voss. His students listened with the intensity of people learning surgery that could mean the difference between life and death. "The key is speed without panic," Park explained, his voice carrying the authority of someone who'd learned from the best. "Commander Kane taught me that perfect conditions are a luxury. You work with what you have." Eve smiled slightly. Park had stopped calling her Dr. Kane weeks ago, insisting that her rank meant something worth remembering. James Nakamura approached, carrying a tablet. "Media's here for the opening ceremony. Captain Voss arrived 10 minutes ago in full dress uniform. And there's someone else waiting in your office." "Who?" "Rear Admiral Crane. He said it's important." Eve found Crane standing by her window, holding a sealed envelope with Navy insignia. "Commander Kane." He turned, his expression unreadable. "The Secretary of the Navy asked me to deliver this personally." Eve took the envelope, feeling its weight. "What is it?" "Honorable reinstatement as Navy Reserve Commander. Medical consultant position with Naval Special Warfare. You'd train combat surgeons, develop new protocols, advise on disaster response." He paused. "No active deployments unless you volunteer. No chain of command conflicts. Just your expertise where it's needed most." Eve opened the envelope. scanning the official letterhead and formal language that translated to, "We were wrong, and we need you back. This is a significant offer," Crane said quietly. "The Navy doesn't often admit mistakes. This is as close as you'll get to an apology." Eve walked to the window. Below, the ceremony was beginning. Captain Voss stood at the podium, her recovered strength evident in her posture. Beside her, the 12 sailors Eve had saved stood in formation, alive, healed, grateful. "3 years ago you gave me a choice," Eve said. "Accept discharge quietly or lose everything. I chose survival." She turned to face Crane. "Today, I'm making a different choice." She placed the envelope on her desk, unopened. "I'm exactly where I need to be, saving lives without waiting for wars to create them. This institute will train surgeons who can work in impossible conditions, who can improvise when protocols fail, who understand that saving lives is more important than following orders." Her voice was steady, certain. "I don't need the Navy's approval anymore, Admiral. I have something better. Purpose." Crane studied her for a long moment, then nodded slowly. "The offer stands. If you change your mind." "I won't." He left without another word. Eve descended to the ceremony. Captain Voss saw her and smiled, the kind of smile shared between people who'd faced death and won. "Ladies and gentlemen," Voss said into the microphone, "I present Dr. Evelyn Kane, director of the Oceanside VA Trauma Institute, and the reason 12 sailors are standing here today." The applause was thunderous. Later, in Operating Room 1, Eve stood beside Dr. Park and James Nakamura, teaching a complex vascular repair to 4 residents. Her hands moved with the practiced precision of someone who'd done this 1,000 times, but her voice carried something new. Not just expertise, but hope. "The patient doesn't care about your credentials or your past," she told them. "They care that your hands are steady and your commitment is absolute. Everything else is just noise." Through the observation window, she could see the Pacific Ocean stretching toward the horizon. No longer an escape route, but a reminder of how far she'd come. They'd tried to bury her for doing the right thing. They'd stripped her rank, destroyed her career, and forced her into shadows. But you can't bury someone who refuses to stop saving lives. And in the end, that was the only story that mattered.